Hi everyone, Dr. Patrick Lynch here, and I'm just going to talk a little bit about symptom presentation for Babesia and Bartonella. So Babesia and Bartonella are considered a malarial type of pathogen. It's a pathogen that will get inside the red blood cells and consume the oxygen and the iron inside the red blood cells. We can become oxygen deficient and we can become iron deficient. Some of the things that can happen when we develop iron deficiency is hair loss. What is the first thing that's not needed in the body so everywhere else can get sufficient iron delivered to the rest of the body? The hair. So hair loss is one of the things that presents with a malarial type of infection. Also with iron deficiency, people will have fatigue. People will also have fatigue with iron deficiency. With oxygen deficiency, when people have, less oxygen in the blood, the heart rate will speed up. So it can deliver what oxygen it does have everywhere in the body where it needs to go. So symptoms associated with Bartonella, we'll talk about Bartonella first, so we can differentiate the difference between Babesia and Bartonella. So Bartonella is considered a bacteria. Babesia is considered the protozoa. They may or may not be the same size, but they are both microscopic and they can both inhabit the red blood cells. They inhabit other tissues of the body, not just the red blood cells. They will get into the vascular tissues. They will get into the organ tissue, they get into the nerve tissue, they get into the brain tissue, they get anywhere. So let's get into it. Anxiety is commonly a symptom associated with Bartonella, migraines, burning eyes, ear issues such as tinnitus, or sometimes people have like a crawly sensation in the ear or ear pain. Sometimes people will get a pimple behind the ear, like this big old pimply growth, and it'll get big and it'll finally come to a head after maybe 2 or 3 weeks, and then it will drain for like a week. It'll just be this big, messy, draining, pimply thing. That's a common thing. It's weird, but it's Bartonella. So people will have emotional highs and lows, shortness of breath with episodic tachycardia. Sometimes the tachycardia is constant. A lot of times it is. People will have POTS, postural orthostatic tachycardia syndrome. People will have panic attacks. People may have night sweats, nightmares, intermittent burning pains. They'll have costochondritis-like pains. Costochondritis pain, burning pain, anxiety and nightmares and night sweats, those are key things, as well as calf cramping. Those are key symptoms of Bartonella. Costochondritis is, people will think that they have heart issues and they will go to the ER and they'll get checked out because they'll have this gripping pain in their ribs. It'll just kind of be really aching, or they'll have pain in their sternum. They will also commonly have pain in the area of their left chest. It can be considered angina-like pain or pericardium pain. There's a lot going on over there near the heart. So there could be some sort of inflammation going on. Dull, achy pain over the area of the left chest is a common symptom with Bartonella. Nightmares, night sweats, calf cramping. Calf cramping is a definite Bartonella symptom. Sciatica, numbness and tingling in the face. Facial palsy is a common symptom of Bartonella. The facial palsy lines up with cramping, costochondritis, night sweats, nightmares, panic attacks, tachycardia, things like this. If facial palsy lines up with those other Bartonella symptoms, then you know that it's likely Bartonella. Burning pain in the genitalia and or bladder. Whenever you have burning pain, that's commonly Bartonella. Bruising easily, spider veins and varicosity, commonly Bartonella. Pain in the back of the head, like around the occiput region, is commonly Bartonella. That will also accompany neck pain, neck tension, pain between the shoulder blades. Neurological symptoms such as nerve pain, constipation can be associated with Bartonella, as well as urinary retention. When people go to urinate at times, the flow is significantly slower than it normally is. There can be crossover with other pathogen, but Bartonella will cause it too. So let's revisit these a little bit more so we can explain why people have these symptoms in detail. So anxiety, Bartonella likes to get into the brainstem. Likes to get into the medulla. The brainstem is associated with our mental health and our emotional state. The burning pain associated with Bartonella is associated with the immune system responding to the antigen. Ear issues, inflammation of the ears. Again, Bartonella will infect the brain, and it gets into the brain. There's a space of the brain that's near the medulla, near the cerebellum, that can get infected. And when it does, then it can cause auditory types of symptoms, such as tinnitus and other symptoms associated with the ear. Bartonella can and does get into the vascular system and gets anywhere and everywhere in the body. And typically the ears are affected. There's a lot going on in the ears. And so when we have inflammation in the different areas of the ears, we're going to have things like inflammation, pain, sound sensitivities, and things like this. Emotional highs and lows, we talked about this. When the pathogen gets into the cerebellum and we have inflammation in the cerebellum, the emotional center of the brain, we are going to have highs and lows, bipolar-like symptoms. So people who have bipolar disorder and or schizophrenia most likely have a chronic infection in the brain. So people don't have to go down the road with the diagnosis of bipolar disorder and or schizophrenia and not have it be put behind them. We can get rid of this. We can help people reach and remain in remission if we approach it the right way, if we approach it as if there's a cause to it rather than manage symptoms. POTS, postural orthostatic tachycardia syndrome, is another symptom associated with Bartonella. Panic. Panic can be associated with Bartonella in the cerebellum. Intermittent night sweats, nightmares. Okay, now we're in territory that can get woo-woo, and we might need to save this for another episode. We'll talk a little bit about nightmares. Babesia and Bartonella, these malarial pathogens enable the body to have symptoms that are just crazy nasty, where people want to kill themselves a lot of times. They are not fun. They are dark pathogen. This is a living organism. This is a bacteria. This bacteria colonizes in the body. It's a possession. It has an identity. It has consciousness. Just because it doesn't have a big brain doesn't mean that it's not intelligent. Doesn't mean that it's not tapped in. It doesn't mean that it doesn't have thoughts or feelings or so forth and so forth. I'm not saying that it does, but I'm also not saying that it doesn't. What I hypothesize is, nightmares is, we're dealing with a potential dark pathogen, an evil pathogen with evil intention. It might come from a dark place. Where are these dark places? I don't know. I've heard stories about, this and that and the other thing. The people that attract these certain types of microbes, they don't necessarily have to be dark individuals. Mosquitoes carry these microbes. Other vectors carry these microbes. They're everywhere. Bartonella is everywhere in the United States. They like marshy territories, they like rivers, they like lakes and streams and things like this. So wherever there's mosquitoes, a lot of times there's Bartonella. And so when we go swimming in the rivers, ocean, and lakes, it's a good idea to take a shower, pretty soon afterwards. When we get bit by mosquitoes, clean it off and put some clove oil on there and keep clove oil on there for 3 or 4 days or so. And that will best assured kill any microbes that come out of the mosquito or any of the vectors that bite us. So when we get bit, don't just be like, well, what do I do now? Go see a doctor? Treat your bite, man. Clean it off, put some alcohol on there, maybe put a little DMSO on there after you put some alcohol on there, put some clove oil on there, and keep clove oil on there for about 4 days. And if you get bit a lot, then treat all your bites. I overcame Babesia and Bartonella. And when I knew that I overcame it, I had a dream. And I had a dream of this crazy looking demon, sitting up on a stage. And he was just this crazy looking, dorky, evil demon. I'm in a crowd of people and he's on the stage, and this is a dream. This is not a nightmare, this is a dream. And I'm like looking at him and he's looking at me, and I'm like, okay, this is weird. And all of a sudden he goes up in flames and he's looking right at me while he's going up in flames, and as he burns, he disappears, and he disappears into nothingness. From that point on, I didn't have any more Babesia symptoms and or Bartonella symptoms. That's one of the things that I ask my patients, and when they become symptom free of Babesia and Bartonella, and it's been a couple of months since they've had symptoms associated with, and they're at the tail end of treatment. I'll ask them, hey, have you had any weird dreams? Specifically of, seen any like, demons burn up or anything like that. And sure enough, they all do. My last patient, this woman from Australia, she was born with babesia. You can see it in her eyes. They might be wonderful, beautiful people, but they have this look in their eye that something else is there, someone or something, and it's dark. It's not in the whites of the eyes, it's not necessarily in the pupil, it's in the pupil and the color. It does present physically, but it presents subtly physically with a strong energetic appearance. And that's babesia, especially when these people see things and hear things and have visitations and have these morbid like symptoms of nightmares and pains, burning pain, electrical sharpshooting pains, cramping, mental health issues. Sometimes the mental health issues are severe, like schizophrenia, like issues like hearing things, seeing things. They feel possessed, and they might feel like they're somebody else for a little while. I mean, this is commonly babesia. It can be Bartonella when it's really bad, but it's commonly babesia. And I'll ask these people when they're done, I'm like, well, you ever have like a vision of, like some sort of demon, like in your dream lately, within the last month or so? And, maybe they caught on fire, maybe not, maybe something else weird happened. And every time I ask a question like this, they're like, man, you ask the strangest questions. And yes, I did have a dream. And everybody says that they dream like this demon burns up. And it's different every time. Like, for example, this woman in Australia who had a Babesia infection since she was a little kid, potentially born with it. When it was finally gone, she was 19 years old. And, she said, you know what? I was in this dream in the desert, and I came across this really good looking man who was dressed in a suit. And he looked at me and he said, come here, come over here. And she's like, and she felt that he's a good looking guy, but she felt as if he was not a good person. And she's out in the middle of the desert and she didn't really think anything of it. And it was just him and her. And she's in dream world. And he's like, it's okay, come over here. And she's like, no, that's all right. And then he just turns around and starts walking towards her and stops and catches on fire. And then he just disappears into nothingness. And then she woke up and she's just like, she never forgot it. And then she told me about it, and I'm just like, that's interesting. So maybe there's some sort of spirit involved with Babesia. Maybe there's some sort of weird possession there or something. I don't know. But many people, everybody who I talk with, who I ask that question to, they have similar dreams of a demon burning up with Babesia. It is what it is. So at any rate, let's keep going down the list. Calf cramping with Bartonella, associated with magnesium deficiency a lot of times. So when people have calf cramping and they have constipation, I don't know one doctor who doesn't say take magnesium. Why would somebody have a magnesium deficiency in the first place? And so people take magnesium. Oh, I must be magnesium deficient. I wasn't magnesium deficient for 30 years, but all of a sudden now I'm magnesium deficient. Do people think about why they're magnesium deficient all of a sudden? No, they don't. They just consider them being magnesium deficient. So they take magnesium and their calf cramping gets under control a little bit. And, they have better bowel movements for a little while. And after 6 months to a year, they notice they have to take a little bit more magnesium and they have to take more and more. And then by then they bruise easily. They have bloody noses. Their mental health disorders get flared up easier. All kinds of symptoms worsen. With the magnesium deficiency, Bartonella is consuming the magnesium that we're eating and the magnesium that we have in the body. And so when people take magnesium when they have a Bartonella infection, they're satisfying the infection. And when Bartonella gets hungry again, it will increase its motility. And when it increases its motility, let's say in the nerve associated with the calf, then the immune system will respond to the increased motility of the Bartonella and cause inflammation in the nerve, which can cause cramping. And so then we consume some magnesium, and then the Bartonella is like, yeah, okay, cool, thanks. I can chill out. And so it chills out, and the immune reaction goes away, and the calf cramping goes away. So, I mean, come on. And so what do you do? We'll talk about what you do. But anyway, that's the mechanism for calf cramping. It's one of the mechanisms for constipation. Sciatica, low back pain with sciatica. Babesia or Bartonella is a neurological pathogen. It's a blood-borne pathogen. It's a vascular pathogen. It's a neurological pathogen. A pathogen that invades most tissues of the body, if not all. But sciatica is very common with Bartonella. When it gets into the spine, then the immune system responds to the presence of Bartonella in the spine, causing spinal inflammation, nerve root inflammation. And so the nerves that leave the transverse processes on the vertebral bodies of the spine, those channels where the nerves go through are very small. And when those nerves get inflamed due to the immune system responding to the presence of Bartonella, then we have sciatica as well as nerve pain. Numbness and tingling in the face. That's just a common Bartonella. It gets into the tissues of the face, gets into the tissues of the nerves, gets into the vascular tissues of the face, and it's the immune response to the tissues that will give us numbness and tingling and burning in the face in particular. Facial palsy is common with Bartonella. Burning pain in the genitalia and bladder. There's a lot of energy in the genitalia. It is what it is. Bartonella, any type of pathogen will go where the energy is. We have nerves there, we have blood vessels there, we have lymphatic channels there. We got a lot going on down there. So when Bartonella gets down there and leaves behind antigen or gets hungry or whatever it is, and the immune system responds, then we are going to have burning pain in the genitalia and the bladder area. People bruise easily with Bartonella. Why do people bruise easily? Bartonella gets into the vascular tissue. And when it gets into the blood vessel tissue, it weakens the blood vessel tissue. So when people get bumped or they bump into something, they bruise easy. So what is a bruise? It's a leakage of blood that comes out of the vascular tissue. Then the blood doesn't clot very well. Same with nosebleeds. When people have elevated blood pressure and they have these symptoms, it can be associated with the immune system causing vascular inflammation. And when the people have vascular inflammation, the channel that the blood flows through is more narrow and it's more constricted. And when it's more constricted, then we have a more rapid heart rate and we have an increased blood pressure. When the inflammation goes down, then the channel widens, it dilates, and then the heart can rest a little bit more, and the blood pressure can reduce as well. Spider veins and varicosity. We're talking about vascular inflammation. Commonly, people will get spider veins in the upper thighs and varicosity in the legs. We stand all day. The body has a harder time pumping blood from the lower parts of the body, and it may get backed up a little bit, causing varicosity, which causes the varicose veins in the legs. When the vascular tissue in the legs are weak and blood stagnates, we'll have leg pain and we will have varicosity. Pain in the back of the head. We're talking about inflammation in the brainstem, in the medulla, in the cerebellum. We're going to have inflammation back there. And when we have inflammation back there, we're going to have pain. The back of the head is also the cerebellum, the brainstem, the vagus nerve innervates there. It leaves there, and the vagus nerve innervates all the organs of the body. It's associated with the parasympathetic nervous system, and it's associated with, breathing, heart rate, liver function, kidney function, digestive function, immune function, as well as peristalsis, digestive function. Autonomic function, we can develop autonomic dysfunction. And when we have autonomic dysfunction, we have symptoms associated with digestive issues. We might be constipated. We might have intermittent episodes of tachycardia. We might have atrial fibrillation, where we have a skipped beat every now and then. We may forget to breathe. Our breathing pattern doesn't normalize, and our breathing is not automatic, so to speak. Liver function might be compromised. Kidney function might be compromised. Bartonella will get onto the vagus nerve, and it will start consuming the nerve sheath. It will send chemical messages to the brain. And that's a whole nother story when these microbes send chemical messages to the brain. Who's really in control? There's some pretty good people out there. And, where these chemical messages are sent to the brain, people are still themselves. They still have integrity when they have these dark pathogens sending chemical messages to the brain. However, there are some people and children who aren't really seated in themselves quite yet. They're not solid in themselves. They haven't necessarily grown up or have learned from their lessons, so to speak. They don't have the integrity that other people do. And these are the people who are more vulnerable to these chemical messages that are sent to the brain from these pathogens. Urinary retention. So we get Bartonella in the ureter, and the ureter has inflammation, and then it's difficult to urinate. We might have bladder inflammation, and a combination of bladder inflammation, kidney inflammation, ureter inflammation. We're going to have difficulty times urinating. Now we'll talk a little bit about Babesia. Babesia is also a malarial pathogen, and any of the above symptoms that we talked about with Bartonella can also be Babesia. How do we differentiate between Bartonella and Babesia, and is it really important? I think it's good to know if people have Babesia or Bartonella, depending on what kind of doctor you are and what your method of treatment is and so forth. Babesia is a protozoa, Bartonella is a bacteria. There are things that you can utilize that will kill both pathogens. They behave a little bit differently in terms of their antigen. Babesia has GI type of symptoms. So if people feel like there's like a little alien in their abdomen kicking their organs around, or if they have a tendency towards Crohn's disease or ulcerative colitis or some sort of IBS with electrical, like sharp shooting pains, inflammation of the abdomen, things like this could be Babesia. However, one of the key components to Babesia is any of the above symptoms associated with Bartonella with electrical sharp shooting pains. They're like zap-like pains where we feel like a zap going through the body. And it could be anywhere. It could be in the flanks, it could be in the legs, it could be in the brain, it could be in the eyes, it could be in the bladder, it could be in the genitals, it could be anywhere. It could be in the abdomen. And when we have these electrical sharp shooting pains, and we have these other malarial type of symptoms associated with what we just discussed, then we're looking at Babesia. When the mental health symptoms are a little bit more severe, especially with the sharpshooting electrical like pains, people who have symptoms associated with schizophrenia and they have the electrical sharpshooting pains and other malarial type of symptoms. Facial palsy is common for people who have schizophrenia. Then, babesia is common. Sleep paralysis. The eyes just give it away every time. Somebody walks into my clinic and, they want to see me because they have some chronic condition. The moment I look at their eyes, if they have babesia, I can see it right away. It all looks the same. It's like looking at a demon. That's the only way I can put it. It is what it is. I'm dealing with an infection that has, a dark presence to it. We get rid of the infection and that dark presence in the eyes is gone. People look completely different. Those are symptoms associated with Babesia and Bartonella. In terms of blood work, what are we going to find with blood work? You're not going to find much. You're going to find some iron deficiency. You might find some slight elevated blood urea, nitrogen levels, elevated bun. Generally speaking, people aren't going to find much. People will argue that, but I'm a clinician and I look at people's blood work all the time, and I don't see a lot of irregularities with people's blood work. One of the things that I look for is I look at what the white blood cells are doing. I'll look at the basophils, the eosinophils, and if there's any elevation there, then, I'll know that there's, a little bit more of an acute infection going on. If the white blood cell count is low, then that's obviously indicative of a chronic infection. If the size of the red blood cells are larger, then that can be indicative of a chronic infection, specifically malarial, because when pathogen gets inside the red blood cells, potentially the red blood cells get bigger. When we have an elevated red blood cell count, so to speak, when the body's producing more red blood cells than normal, it could be because the presence of the pathogen is consuming the iron and the oxygen. And so the body's like, okay, well, we need more iron, we need more oxygen. So we're going to produce more red blood cells so we can provide space for more iron and oxygen to come in. I don't test people because I don't need to test people to find out what people have. And I just treat people and they get better. And I can see what they have. But when people get tested, they have 1 in 50 chances of testing positive for the pathogen that they're testing for. If it's a PCR test, the PCR test has an image of the DNA of the pathogen at a certain time and space. And at the single cell pathogenic level, the DNA is always in a constant state of flux. And this is found by Dr. Alan McDonald, who's a medical doctor, PhD. He had deceased with Lyme disease. And he's the one who had found that the amyloid plaques in the brains of cadavers who died with dementia, Alzheimer's, and general paresis, these amyloid plaques harbored life. They harbored spirochetes, microscopic roundworms, syphilis, H. pylori, Lyme disease Borrelia, leptospirosis, trichomonas, whatever they are. They're pathogenic. Could they be other bugs too? Absolutely. It's not that they're not accurate, but they can fail. And if you test yourself for Bartonella or Babesia and you get a negative laboratory result, it doesn't necessarily mean that you don't have it. It just means that it didn't show up. Same with the antibody test. If your antibodies are not going after Babesia or Bartonella anymore, it's probably because they can't find Babesia or Bartonella. Babesia or Bartonella will mutate their DNA to where they're half human DNA, half pathogenic DNA. This is also found by Dr. Alan McDonald, MD, PhD. has written articles about this. Dr. Richard Horowitz has given the world a lot by testing over 13,000 people and categorizing their symptoms based on their positive diagnosis. I studied his work, and malarial pathogens, Babesia, Bartonella, other malarial bugs, they will present like this. This is information taken from Dr. Richard Horowitz. Dr. Richard Horowitz, he has a video on YouTube. It's called Co-Infections. Watch it. It's great. I've probably watched that video maybe 50 times, and I watch his other videos too, and he's a good man. You can diagnose based on symptoms. In fact, you know, Lyme disease it's a clinical diagnosis. So can Bartonella be a clinical diagnosis? They're considered co-infections to Lyme disease. So you can diagnose somebody with Lyme disease with co-infections that's referred to as MSIDS, which is multiple systemic infectious disease syndrome, and treat them accordingly. I go after widespread bacteria, spirochetes, which are bacteria, protozoa, which is Babesia and more, which is a microscopic parasite, yeast, fungus, mold, viruses, and parasites. If you go after everything and clean out the body of everything and leave nothing behind, then you're sure to get the job done. But if you know how to diagnose to figure out what somebody has, you can keep an eye on that. And when people present with Babesia and Bartonella only, and you go after everything in a way where you really understand how to go after it and offset pathogenic resistance, and then know when to go deeper, and then when to go deeper again, and then when to go deeper again, that's the key. You want to go eventually as deep as you can go, and you need to know how to go as deep as you can go into the body. In Chinese medicine, they call that the luomai. The luomai is the dark space where blood and body fluids don't go very easily and very well. And medical doctors, they don't know how to do that. The vascular system it is what it is to them. We have what we have with the individual that has a compromised vascular system due to an infection. Chinese medicine doctors, they can open up the vascular system. They can clean the vascular system. They can dilate the vascular system. They can push blood through the capillaries of the vascular system. They have guiding herbs that will guide to anywhere that you want to go in the vascular system. Whether it be the lower part of the body, whether it be the brain, whether it be the eyes, whether it be the throat, whether it be the genitals, whether it be the low back, or whatever, whether it be the discs, whether it be the cartilage, whether it be the tendons, the ligaments, the fascia, the muscle, whatever tissue. We have so much in terms of understanding herbs. It's not just like, oh, this herb does this and this herb does that. That's Western herbalism, whatever. I can't even claim what Western herbalism is. So don't quote me on that, because I'm not a Western herbalist, but maybe backyard herbalist, so to speak. But Chinese medicine, it's pretty incredible if you know what you're doing in Chinese medicine to help people get cleaned up and get cleaned out. A lot of American doctors, a lot of naturopaths, they'll think, oh, this person's not getting better. It must be biofilm. If they're not getting better, you don't just go after the biofilm or cystic formations in the body. That's just stupidity. And the reason why is because when pathogens are locked up in their safe little houses, they're not causing symptoms. They're locked away. They don't cause symptoms until they're let out of hiding. That's why so many people started presenting with autoimmune presentations with COVID. It's because when people got COVID, it weakened the immune system. And when COVID weakened the immune system, then all of our pathogenic colonies that were locked up in their safe little houses because our immune system was at one time strong came out and infected the body. And then everybody thinks they have long COVID, which in actuality, they just have what they have. They were just let out of hiding. So when people aren't getting better, it doesn't mean go after the biofilm. It just means figure out why the person's not getting better. There's so many factors. Medications will prevent people from getting better. Mold in the environment, in the home or the workplace will prevent people from getting better. Stress will prevent people from getting better. Significant stress, trauma, foods, supplements will prevent people from getting better. Foods and supplements, magnesium, folate, will prevent people from getting better. People, if you have a malarial infection and you're taking folate and magnesium, you will not get better. It just will not happen. In fact, I had a patient years ago, and this patient wasn't getting better after a couple of months, and I'm just like, all my patients get better after a couple of months. I'm like, what the hell is going on with this guy? And I'm just beating my head into the table, like, what's going on here? And I'm thinking, okay, what did I do wrong? What did I not get? This guy's a little stubborn. He does what he does and does what he wants to do. And I'm like, no, you have to do things my way, or it's not going to work and we can't work together. Go find somebody else to work with. You got to do it my way. And and so I told him, you need to let me know all the supplements that you are taking. You need to do these dietary modifications and they need to be impeccable. And this is your trajectory for the next 2 months. This is what you need to do. Call me or text me if you have any questions anytime. Because if people call me or text me anytime with questions, then they're more likely to get better by the time we meet again at the 5 week mark. And so I told him, I reminded him like 5 times. I'm like, hey, get me your supplement list. Get me your supplement list. Get me your supplement list. And he never gets me his supplement list. And we meet at 5 weeks, and he's like, Patrick, I'm not getting better. I feel like I'm getting worse. This is not working for me. I'm like, well, what's going on? Why not? What are you doing? Are you not doing the dietary modifications? He's like, I'm doing them impeccably. I'm taking the herbs, and I lost 30 pounds, and I'm just thinking all these thoughts of possibilities, and I'm just like, he never sent me a supplement list. And then I told him, I said, you never sent me a supplement list. I asked you that 5 times. And he was like, no, I didn't send it to you. I didn't think it was important. I said, I asked you 5 times to send me your supplement list. It's important. I said, are you taking folate? He was like, yeah, I'm taking a double dose for my nerve pain and nerve regeneration. I said, man, you can't be taking folate. And I said, what else are you taking? Are you taking magnesium? He's like, yeah, I'm taking magnesium for this, that, and the other thing. And I'm just like, you can't take magnesium, with Bartonella infection. And I said, what else are you taking? He told me what else he's taking. And he finally gave me his supplement list. And I got rid of all of his supplements except for vitamin D drops and some vitamin C. And that's about it. And within 4 days, 4 freaking days, he was significantly better. He texted me like 4 days later and he was like, man, you're right. He was like, I feel so much better after stopping the magnesium and the folate. And I said, and you're not having cramping, right? He was like, no. These things are important. Basically, when you stop the motility of the pathogen, then the immune system doesn't need to respond. And then when the immune system doesn't need to respond, then we don't have symptoms or we have less symptoms. So we either have less symptoms or we have no symptoms. Stress can increase the motility of the pathogen. Physical, mental, emotional, environmental stress can increase motility, as well as supplements, as well as foods. So if you know what to eat and what not to eat, if you know what supplements to take and what not to take, and you keep your stressors under control, you stop the motility of the pathogen, you can get on top of it and then knock it back. And then when you stop the motility of the pathogen, you're not stuck with die-off reactions and immune reactions. A lot of times when people get started with treatment, they just blow up and they're just like, I'm not going to do this. This just makes me suffer even more because they have immune reactions because of the pathogenic motility and the immune system responding to it. And they have die-off reactions because they're taking something like an antibiotic that can't be managed in terms of dosing. So they get this full dose of an antibiotic and they're feeding their bugs, and their bugs are motile and the immune system responding. It's like a big old freaking war zone inside the body. And people are a mess and they're like, no freaking thanks. And so then they don't treat themselves. So if you don't feed the pathogen and you bring the pathogenic motility down to the point to where they cannot proliferate, and you use Chinese herbs and you start with a really small dose and you increase the dose as people tolerate it till you get to a maximum dose, then you can keep people stable, you can keep people mellow, you can keep the symptoms down, and then get on top of the pathogenic load, knock it back, get it gone. So the next video, we're going to talk about treatment. We're going to talk about how to knock the pathogenic load back and how to knock it out to the point to where you have sustained remission, and then how to prevent it from coming back. If you have Babesia and or Bartonella or chronic infections, I'm sorry that that's going on with you. I've been there. I've ridden the ridge of life and death, and I've helped many people who were riding the ridge of life and death and considering killing themselves, get their health and their life back. And if you're in that place, consider looking me up. I can do a Zoom consultation with you and help get you back on your feet. If you are a good candidate for this, and I feel like you're a good candidate, then when you resonate with the treatment plan and we feel like we can work together, then let's do this. So other than that, God bless and take good care.